about 5 or 7 years ago, I started learning about the modern era clinical trials with psilocybin in particular, which is one of a number of psychedelic substances. And the studies were showing that people approaching end of life who had debilitating anxiety and depression, if they had a single guided dose with psilocybin, they had immediate, substantial, and sustained relief. And when I read that, I nearly fell off my chair because I knew that the missing tool in the palliative care toolbox was a tool for relief of non-physical suffering. And so I right away turned my attention. I had had no prior interest in psychedelic law or policy, but I turned my attention to how can we open access. And I've spent the last 5 years in that advocacy arena.
So I'm even go back before that. So even before you got interested in psychedelics, you were interested in people's their dignity in dying. So
Yes.
where I don't know that many attorneys that pick that as their interest. What was the catalyst that made you start being interested in that when you started law practice?
Yeah. Well, I saw it as a really important individual liberty, personal autonomy issue. And is anything ever really random? I sort of randomly, as a very young attorney, stumbled upon the nation's first initiative campaign to pass a law that was called Death with Dignity. And that was in Washington State. I was practicing in Seattle. And I volunteered to be pro bono counsel to the campaign. And so that brought me into the arena, and the initiative came close but did not pass. It was the platform that was the springboard in Oregon a couple years later to become the first state to adopt such a law. But I was so compelled by the issue of empowering dying people with a compassionate choice. Because, of course, as you know, modern medicine can extend life. And now people can find themselves trapped in a dying process that they feel is taking too long. And so the choice to be able to precipitate a peaceful death is important. And it's now increasingly widely available across the US, which is good. But then no one wants to think someone would choose that because they had unrelieved suffering, and hence my interest in psilocybin-assisted therapy.
I read that you had read an article by Michael Pollan that kind of
Yeah.
helped move you in that direction. What was that article?
Yeah. So maybe some of your readers also love the New Yorker magazine.
For
And it
sure.
was his article in the New Yorker called The Trip Treatment. And that article then was expanded into his book, which is a national bestseller called How to Change Your Mind. Many of you may have read that. And it's really quite wonderful because Michael, I know he's known to the ranch and to Deborah. He has a wonderful ability to take complicated things and make them so easily accessible to non-scientists. And he did that with that wonderful book, which then became a 4-part Netflix series, also called How to Change Your Mind. But what Michael recounted in the article that really woke my attention was that a single guided session with psilocybin brought such immediate and enduring relief. So imagine you have a terminal illness, you're confronted with the reality of death soon. Not most of us think it will be sometime long away, but soon. And that brings you existential distress. Imagine being able to have a therapeutic session with this drug and feeling all that anxiety drain away and coming to peace with what is real for you in that moment. It just seemed so important to bring that to the bedside.
When you said twice now, a guided therapy session. So
Yeah.
what does that mean? What does that entail?
Yes, that's a great question. So this is a drug that would not be a dispensary model. You would not go to your corner dispensary like people do with cannabis. This is a drug that has a very powerful impact on the consciousness of the person ingesting it. And while they are under the influence, they are with a person trained to sit with such a patient. and help them experience it, and kind of trip sit or take care of their body while they're having this very intense alteration of consciousness.
Mm-hmm.
Now, it is true that the person who might be the trip sitter could be a physician, it could be a mental health professional, or as is happening now in Oregon, which has a state legal program for psilocybin, it's simply someone who's taking a training module on how to successfully be a companion to someone who's taking that medication. The most important part that everyone points to with this drug is the therapy that follows with what's called the integration. And that's where the person who had ingested the drug would really talk with a skillful therapist about how to integrate the experience of having been with that drug into what they're dealing with.
So, and you said it's kind of an immediate relief of anxiety for someone. What is the chemical process that happens in the brain when you take psilocybin?
Yeah, so I'm not a scientist. I'm a
But just
lawyer, but
in
what
general,
the reports are, and this is why this drug and similar drugs are so effective for a variety of mental health challenges. It takes the person out of their default mode. It helps them step out of a recurring cycle of depressive thought, or it's also a drug that is being tested for relief, for example, of PTSD, where trauma puts someone in a locked room that they can't get out of. It's being tested for use with addiction, with substance abuse disorder, because it helps the person step out of a recurring cycle. It is a default reset, if you will. And in the context of a person with terminal illness, it's a default reset where the person has the experience of seeing their life in a much larger frame. And so the fear of death diminishes, and comfort with what the mystery of life and the mystery and wonder and beauty of life and what happens at death becomes more accessible.
what is the lasting effect of that? I mean, if a person has a month left to live and they do this treatment, do they need to do it again in like 2 weeks or?
Yeah, well, what's so interesting is the clinical trials have shown that the impact is enduring, that a single trip will be giving relief months later. And
Wow.
so they have done that where they've gone back to people and checked in. Are you still receiving the benefit of that experience? And the answer is yes. And so that's why it's so exciting. And it's not a drug that you need to take chronically. You don't need to keep taking it like a daily antidepressant.
Yeah. And just for listeners who might not know, it's derived from mushrooms, right? Certain kind of
Yes.
mushrooms, right?
Yes, from the psilocybin mushroom. And, you know, being in Mexico as the ranch is, as you know, the ancient tradition in Mexico with this mushroom is a long and storied tradition. And we have much to thank the indigenous peoples of Mexico for bringing this medicine forward and into use. Yeah.
Right. What are some of the other psychedelics that are being used to treat people?
Yeah, there's a lot of excitement, and I've followed psilocybin most closely because it's been the drug shown both safe and effective with people with advanced illness. But there are ongoing trials with ibogaine, with LSD, with MDMA, with
Right. Okay.
ayahuasca, and these are all other
Right.
psychedelic substances. They all sit on Schedule 1 of the Controlled Substances Act, which means they're only legally accessible for research. So if you're hearing about people doing these drugs in the US now outside of a research setting, it is all in violation of law, of federal law, which is, you know, why the legal piece of this is so important, trying to promote a federal safe harbor.
What are the legal options that a patient would have right now?
Yeah, so there are some states, Oregon, and then Colorado, and very soon New Mexico, those states have stepped forward to adopt state legalized programs. They provide no federal safe harbor. So in Oregon, where they have an up and running psilocybin program, you would be legal under state law, but still in violation of federal law. And so it's really quite risky to participate. Many veterans, and this is really quite sad, who are at risk of suicide due to PTSD are leaving the US to go to places like Mexico or Jamaica or South America where these substances are legal. And I always feel that it's wrong that someone who served their own country now must leave that country to get the care they need. And that's why veterans have really stepped forward as one of the strongest voices for reform. And that's driving a lot of the interest in federal policy reform.